Cancer of the liver. Hepatic tumors may be malignant or benign. Benign liver tumors were uncommon until the widespread use of oral contraceptives. With the use of oral contraceptives, benign tumors of the liver occur most frequently in women in their reproductive years. Primary liver tumors. Few carcinogenic originate in the liver. Primary liver tumors usually are associated with chronic liver disease, hepatitis B and C infections, and cirrhosis. Hepatocellular carcinoma is by far the most common type of primary liver cancer. Liver metastasis. Metastasis from other primary sites are found in the liver in about half of all advanced cancer cases. Malignant tumors are likely to be reach the liver eventually by the way of portal system or lymphatic channels or by direct extension from an abdominal tumor. Moreover, the liver apparently is an ideal place for those malignant cells to thrive. Often, the first evidence of cancer is in an abdominal organ is the appearance of liver measures, unless exploratory surgery or an autopsy is performed. The primary tumor may never be identified. Clinical manifestations. The early manifestations of malignancy of the liver include pain, a continuous dull ache in the right upper quadrant, epigastrium or back. Weight loss, loss of strength, anoxia, and anemia may also occur. The liver may be enlarged and irregular on palpation. Jaundice is present only if the larger bile ducts are occluded by the pressure of malignant nodules in the hilum of the liver. Ascites develops if such nodules obstruct the portal vein or if tumor tissue is seeded in the peritoneal cavity. Assessment and diagnostic findings. The liver cancer diagnosis is based on the clinical signs and symptoms, the history and physical examination, and the results of laboratory and X-ray studies. Increased serum levels of bilirubin, alkaline phosphatase, AST, GGT, and lactate dehydrogenase may occur. Leukocytosis, increased white blood cells, erythrocytosis, increased red blood cells, hypercalcemia, hypoglycemia, and hypocholesterolemia may occur also be seen in the laboratory assessment. X-rays, liver scans, CT scans, ultrasound studies, MRI, arteriography, and laparoscopy may be part of diagnostic workup and may be performed to determine the extent of the cancer. Positive emission tomograms, PET scans, are used to evaluate a wide range of metastatic tumors of the liver. Confirmation of tumors histology can be made by a biopsy under imaging guidance, CT scan with or ultrasound or laparoscopy. Medical management. Radiation therapy and chemotherapy have been used in treating cancer of the liver with varying degrees of success. Although these therapies may prolong survival and improve quality of life by reducing pain and discomfort, their major effect is palliative. Radiation therapy. More effective methods of delivering radiation to tumors of the liver include 1. Intravenous or intra-arterial injection of antibodies that are raised with radioactive isotopes and specifically attack tumor-associated antigens. And number 2, percutaneous placement of the high-intensity source for interstitial radiation therapy that will be delivering radiation directly to the tumor cells. Chemotherapy. Chemotherapy has been used to improve quality of life and prolong survival. It also may be used as adjuvant therapy after surgical resection of hepatic tumors. Systemic chemotherapy and regional infusion chemotherapy are two methods used to administer anti-neoplastic agents to patients with primary and metastatic hepatic tumors. An implantable pump has been used to deliver a high concentration of chemotherapy to the liver through the hepatic artery. This method provides a reliable, controlled, and continuous infusion of medication that can be carried out in the patient's home also. Percutaneous biliary drainage. Percutaneous biliary drainage or transhepatic drainage is used to bypass biliary ducts obstructed by the liver, pancreatic, or bile duct tumors. In patients with inoperable tumors or in those considered poor surgical risk. Under fluoroscopy, a catheter is inserted through the abdominal wall and pass the obstruction into the duodenum. Other non-surgical treatments include laser hyperthermia, immunotherapy, transcatheter arterial embolization, and ultrasound guided injection of alcohol promotes dehydration of tumor cells. And surgical management. Surgical resection is the treatment of choice when HCC, that is hepatocellular carcinoma, is confined to one lobe of the liver and the function of remaining liver is considered adequate for postoperative recovery. In the case of metastasis, hepatic resection can be performed when the primary site can be completely excised and the metastasis is limited. The procedures: lobectomy, cryosurgery. And the last one is liver transplantation, that is removing the liver from and replacing it with a healthy donor organ in another way to treat liver cancer. The patient with small tumors may have a good prognosis after transplantation, but recurrence is common with tumors greater than 8 cm in diameter or those that are multifocal or have vascular invasion. Nursing management. If the patient has had surgery to treat liver cancer, potential problems related to cardiopulmonary involvement include vascular complications and respiratory and liver dysfunction. Metabolic abnormalities require careful attention. A constant infusion of the glucose 10% may be required in the first 48 hours to prevent a precipitous fall in the blood glucose level resulting from decreased glucogenesis. Because extensive blood loss may occur as well, the patient will receive infusions of blood and IV fluids. The patient requires constant close monitoring and care for the first 2 to 3 days, similar to post-surgical abdominal and thoracic surgery care. The patient undergoing cryosurgery is monitored closely for hypothermia, hemorrhage, or bile leak. Myoglobinuria can occur as a result of tissue necrosis and is minimized by hydration. Diuresis and at times medications, that is example allopurinol, to bind to and to aid in the excretion of toxic products. If the patient will receive chemotherapy or radiation therapy in an effort to relieve symptoms, he or she may be discharged home while still receiving one or both of the therapies. The patient may also go home with a biliary drainage system in place. The need for teaching is great because of need for the patient to participate in care and the family role in care at home. This percutaneous biliary drainage procedure. Other non-surgical treatments include laser hyperthermia, immunotherapy, transcatheter arterial embolization, and ultrasound guided injection of alcohol promotes dehydration and tumor cells. And also in surgical management, lobectomy, cryosurgery, and liver transplantation already discussed. It is available in the shorts. Please follow. Thank you.